what we're going to do is, so with taking the history, the idea is for me to figure out like, what is the, how's it behaving?
Yeah.
What do we think that the problem is?
Mm-hmm.
And then when we get to the exam, that will help. Then we try to correlate those two things together.
Right.
What's our physical therapy diagnosis? And then what's the treatment plan? So the first thing that we need to know to figure all this out is just where are the symptoms that we're looking at?
So my lower back, and so it started more with my leg going numb all the way down, and then now it's my lower back. I mean, I can definitely localize it in there, but it still goes down to my leg.
The numbness.
And I still, my right foot tingles most of the time. But I will say I am better than I was.
Okay.
I mean, I was in so much pain for a while that, it's like, and it was hard for me to do a lot. But I'm like going to the grocery store, which sounds so stupid, but I couldn't even go to the grocery store and make it through the grocery store because it hurt so bad.
Yeah.
I would just end up leaving. And it was in my back and down my leg.
Okay. And the pain was down the leg as well, not just numbness, tingling.
No, it's pain that it starts in my back and it goes down my leg to the point where it's like it's a numbness that hits my leg, but it's pain too in that I can't move. I can't walk.
Yeah. Okay. Only on the right leg.
Only on the right side.
Any weakness in the right leg?
Well, so I've been going to a chiropractor too for a while now, for probably 3 months, and he's been giving me some exercises and help doing the back thing and stuff. But so I think I have gotten a little stronger on that side. I also do personal training. So I've also my daughter's actually my personal trainer.
Oh, nice.
So I know, right? And so that has helped. I mean, I think that I don't think I'm as weak as I was on that side, but yeah, absolutely it was weaker.
Okay.
So
no feeling like you're dragging your foot or anything like that?
No, I mean, when it gets to where I'm in that much pain, yeah. I mean, it's like it's harder because it's harder to walk.
Yeah. Okay.
Yeah.
All right. And so this dates back how long?
Well, this started in like January.
Okay.
It's been a long haul.
Now, was there a particular injury or event that occurred?
No. So I have 2 hip replacements. And and I don't know, if this is related to that at all. But no, there's nothing that happened. It's just, but I ever since I had the right hip replacement, I always felt like a little bit of a tug on that side from my back, which is how this started. It started with a tug back there and then progressively got worse.
Okay. Gotcha. So started in the back and then eventually
started
traveling down the leg.
It started feeling like a tug that started in my back and pulled on my back of my leg.
Sure.
Yeah. And I've always had for a long time, I've had I'll cramp up my quads, not my quads, my what am I looking for? The back of my leg.
Hamstring.
My hamstrings.
Yeah. Okay.
On my right side, cramp up.
Okay. And prior to January, have you ever had this before?
No.
Okay.
No. Like I said, just what I was having ever since the surgery was that tug, that I felt from the back of my leg.
Oh, okay.
Yeah, that started after the surgery. After.
Okay, gotcha. Yeah. Yep. Okay. But the pain and numbness and tingling and all that kind of stuff, that's January.
Yeah.
Yeah.
Yeah. And it didn't start out that bad. And so, my mentality is you just push through everything.
Sure. Yeah.
And so, I just pushed through it and pushed through it and pushed through it until it got to the point where it's like, I couldn't walk around the block. I couldn't do the hikes. There was a hike that I did every weekend. Can't do that anymore. So really, and I can cycle. I can ride my bike.
Okay.
I can lift, I can do weights as long as, and especially now we've kind of narrowed it down to where we're really trying to brace my back every time I'm doing it and be super careful. But yeah, it's sitting, standing and walking. Standing and walking being the worst. And sitting, I just had to change the chair I was sitting in. Sitting will still get to me after a while, but the standing and the walking is what will get to me
That's
faster.
the primary.
That will get to me faster.
How long can you stand and walk before you have to sit down? Before you have to...
Well, now it's been better lately.
Gotten better.
Yeah, it's gotten better. So now I'd say, I can actually, I show property, right? So yesterday I was probably standing for 45 minutes to an hour. You know, and and what I notice now is my back, it'll start hurting, but it'll get tired first.
Okay.
Which is
But you're
weird.
still getting, if you had to say in the last week, are you still getting numbness, tingling, and pain down the leg in the last week?
Yeah.
Okay.
Yeah. But the difference now is that it seems to come and go a little more. Like,
Mhm.
you know, like before I would have to sit down, and sometimes now I can keep going, you know, or like just it'll start to dissipate. But
Yeah.
yeah, I mean, yeah. So, but if I go too long, it's excruciating.
Yeah.
Yeah.
Okay. And then sitting can also, so when you talk about standing and walking are aggravating, it's aggravating to the leg, not just the back.
It's both.
It's both.
Yeah.
And sitting both as well.
Sitting is mainly my back.
Sitting's mainly the back.
Yeah, yeah. And the standing and the walking is mainly my back, and then it goes into my leg.
Yeah.
Yeah.
Gotcha. Okay. All right. And then, yeah, you mentioned that it's improved. Is the leg symptoms daily? Do you have leg symptoms daily?
Oh yeah.
You do?
Yeah,
Okay.
it's all daily. Yeah.
Yeah. Okay.
I mean, I wish I could say that I could go a day without this. It'd be awesome.
Yeah.
But it is, you know, like I said, it is better. I would was it Dr. Ho was the one who put me on, because I was asking for something. I'm like, he put me on a round of oral steroids, and that definitely helped during that period of time. And then of course it came back, but not as severe as it had been.
Okay. No back surgeries or anything?
No.
So you've had oral steroids. You've been doing chiropractic for the past few months. Any other interventions that have happened?
So just a massage. I tried massage. You know, I've been doing that for probably 4 months. And then, like I say, started that going to the chiropractor about 3 months ago. And then, you know, everything I'm doing in the gym, trying to work with that and work with the exercises that the chiropractor's given me.
Yeah.
So.
Yeah. Okay.
Yeah. Which is another thing that, like, coming here, I really want to be able to implement, obviously, you know, what we're doing into what my workouts are.
Sure. Yeah. Okay. All right. Anything else? So standing and walking are the primary. That's what aggravates us the most.
Yeah.
Okay. And then what about relief? Is there anything that you can do other than medication? Is there any position or activity or?
You know, sitting down for a while absolutely helps. I can only, it helps. It helps my back too. Okay. So I just can't sit for a long time. Like,
what's a long time?
Well, I mean, like if I'm sitting for an hour, you know, sitting for an hour is going to hurt it.
Okay.
But sitting down absolutely helps it. It eases everything off. So it really is the standing and the walking that's the issue.
And then sleeping at night, how do you do there?
I'm fine.
That's fine.
Has never bothered me.
Good.
You know, I always sleep on my stomach anyway, and that seems to be the best relief for this. But I haven't. It doesn't. Yeah, it's never hurt at night.
Mm-hmm.
Yeah.
Good. Okay. Is there anything else you can think of that is sure to aggravate the leg or sure to alleviate the leg that you can think of?
Not really. I mean, it's mainly that, you know, it's standing and walking.
Yeah. Yeah. Okay. That's totally fine.
Pretty basic.
Yeah. It doesn't need to be more things. That's fine. I just want to make sure I'm seeing it clearly.
Well, because it's not like if I, you know, it's not like, you know, I feel like so many times when people have back stuff, they're like, oh, I lift, you know, I can't lift. I can't. Yeah. It's not that. Yeah. You know, it's like, yes, if I do, you know, there were times when we were doing deadlifts and it was like, okay, I was in a lot of pain when I was done. Mm-hmm. Probably shouldn't have been doing that much right then because I was dealing with this, you know. So, but yeah, I mean, you know, it's not like, I mean, and if I'm, if I'm doing a whole bunch of work where I'm lifting, that is going to aggravate it, but try not to do that right now.
Yep. Okay. All right. Any changes in bowel or bladder function? Okay. All right. Any unexplained weight loss?
No.
Okay. And generally, seems like you're generally very healthy.
Yeah. I mean, yeah.
All right. All right. Okay, good. So yeah, nothing else you feel like you want to share about?
I don't think so.
I mean, behind this?
Yeah.
Okay.
Yeah.
So good. So what we'll do now, you know, when we listen to how this behaves, I mean, for us, you know, I think the hope is when symptoms are intermittent, they come and go. There's consistent patterns. I do this for about this amount of time, and it starts to aggravate everything. And then if I do this, it starts to alleviate things. And so the symptoms are intermittent. That's what we would hope to hear, just because it tells us that the condition is able to be affected by movements and positions and time and things like that. And so our job is to figure out, is there a missing strategy? Is there a missing movement-based strategy that would help get you to the next level of recovery? And that's kind of what the exam is about. We'll go through a movement exam and try to figure that out. So are you having any leg or back symptoms right this moment, just sitting here?
So yeah, I can feel it. I mean, it's like I feel it in my back right now. It's not extreme by any means, but I feel it in my back and going down my butt. It's like just a little bit. And like my foot is a little bit numb. It tingling. I won't say it's numb. It's just tingling.
A little tingling.
So it's like, and that's the weird thing is I'll feel this back and forth, but this is like nothing.
Yeah.
It's not that big a deal. I mean, so yeah, that's not bad.
Yeah. Okay. All right. Sounds good. All right. So the first thing that we want to do is, with the symptoms that you have right now, so some tingling in the foot, back, and buttock, we're just going to change the position your back is in while you're sitting, give it a minute, and see if any of those symptoms increase, decrease, or don't change.
Okay.
So if you scoot all the way back in the chair.
Okay.
Yep. And then lean forward. And I'll just put this piece of foam right there. And then just like so. Okay. So let's just have you sit there for a moment, and then you'll pay attention to the intensity of the tingling in your back and that hip area, and let us know if that feels like anything has changed.
I mean, the tingling I can still feel. The back, sort of. Yeah, I can still feel the back.
Okay.
Yeah.
Feels pretty similar.
Pretty similar.
Okay.
Yeah.
And then I'm just going to have you correct that or arch that posture a little more aggressively than you did with the roll.
Okay.
Good, really up. Good, just like that. Okay. So now we'll hold that position. And same question, foot, hip, back, better, worse, no effect.
So foot's still a little tingly, but my back feels better. I can still feel it a little bit in my butt, but my back feels better.
Back feels better. And when you said the foot feels a little tingly compared to before doing this, does it feel about the same, or would you say the intensity is at a noticeably changed level?
It's changed. I think it's better. Yeah, it's better. Yeah.
Okay.
Yeah.
Still feel it, just intensity to reduce some.
Yeah.
Okay. All right. Okay, good. So now let's come on up. And I may have you take a seat on the edge of the table. And then I'm just going to check your reflexes here. So that's a good example of a 2+. And this is absent. Now,
wow, that's a huge difference.
You can feel that?
Well, I can see it. I mean, I can feel it and I can see it.
Yeah. Okay, now I'm going to have you take your hands and just pull them apart. This probably isn't super necessary because there's already a clear difference, but it does allow us just to see how absent it might be. And so you're pulling firmly apart. Okay, good. Keep doing that. And now it turns into a close to normal.
Interesting.
And that is by far greater reflex. So, okay, but there is still a difference. That's the main thing to note there, is that there is a difference right to left. It's nothing to be concerned about. It's just, if there's a nerve that's irritated in your back, then the function of the nerve can become altered. So reflexes can kind of be diminished, strength. So the next thing, while you're sitting here, if I bring the leg right to here, don't let me push it back down. Okay, hold, go. Good, nice and strong, great. Okay, now let's just take your foot and lift up the foot. And don't let me push the foot down. Go. Excellent. Let's take your big toe and push that up to the, yep, and don't let me push that down. Hold. Go, go, go. Excellent. Good. Okay. Don't let me pull the leg out like this. Okay. Go. Great. Then I want you to push against my hand out here. Don't let me push it inward. Okay, go, go, go. Excellent. Now let's have you stand back up. And then you can turn around, use this for balance. And I want to see if you can, on one leg, so you can just do this on the right leg, if you can do these heel raises just on that right side. Yep. Good. Okay, that's enough for what we're looking for. Okay, good. That all looks fantastic. Okay, the next thing, range of motion of your back. So keeping your knees straight, how far forward can you bend forward? Like you're reaching towards your toes. That table might be getting in your way.
Yeah.
There you go. Good, yeah, knees straight. And tell us how this feels.
That feels fine.
Okay, it doesn't affect the pain in any way.
Mm-mm.
All right, you can come back up. Now let's put your hands on your hips like so. Keep the knees straight. And you're going to bend backwards as far as you can bend.
I think that's it before I fall over.
Okay. And that was a good example of a deviation. Could you see the deviation in the video? So if you could bend backwards one more time, far as you can go. There's a rotation away from the painful side. But that has any effect on your pain at all? Back pain, buttock pain, anything?
No.
No.
Okay. Doing those when I was standing there doing the raises, that hurt. That it didn't hurt while I was doing them. It hurt after.
Gotcha. Okay. All right. So now the next movement you're going to do, feet shoulder width apart. Your knees are straight. Your arms are going to be parallel to the floor like this. Okay. And you're just going to move your hips as far as you can, one direction. And tell us how it feels, and then we'll compare the other side.
Okay.
Yep, far as you can, far as you can. How does that feel?
Okay.
Okay, I'm just going to give it a little extra pressure. How does that feel? Any problem there?
Mm-mm.
No. And let's go hips to the left as far as you can. Try to keep the weight fairly equal, right and left. And how does that feel?
Fine.
Okay, I'm going to give it a little extra pressure. And how does that feel?
Fine.
Okay. Now, one more, if you wouldn't mind doing that one more time, hips to the right. Yep, try to keep the weight pretty equal and right and left and just move the hips.
That's what's hard for me, is to keep the weight equal and just move my hips.
It's a little bit of an awkward movement. Okay. And then one more time to the left. So looks like there is some motion loss to a right side glide. Kind of correlates to the deviation and extension to the left. Okay, so now that you're on your feet, your back, buttock, and foot tingling compared to sitting, how are you feeling right now?
It's about the same.
Okay, still feels so you got some foot tingling, back,
just
buttock
tiny
area.
bit. Yeah, just like it's pretty minimal right now.
Yeah.
Compared to where it's been.
Yeah, yeah. Okay, all right. So this part of the exam is where we're looking to really focus on symptom change, symptom behavior. So we're going to go through a few different motions of your back, and we're going to really be focused on your foot more than anything. So the key is, I'm going to show you a picture of something here. The key is going to be evaluating this centralization. So if, right this moment, you're this person right here, you have symptoms all the way down into your foot, and you have symptoms in your back and kind of hip area. So anytime your symptoms travel down the leg, it's an indicator that whatever you're doing is agitating the condition. Anytime you do something where symptoms are alleviated down here, and you're no longer feeling it in the leg. Maybe you're just feeling it. This is somebody that is reporting pain right in the center of their back.
Mm-hmm.
So anytime symptoms travel in this direction, it's an indicator that whatever you're doing is healthy for your condition. We need to promote doing those types of postures and positions and exercises, and anything you're doing that is causing things to spread down the leg, we would want to avoid and whatnot. So because you've got some tingling in the foot right now, that becomes the symptom of interest. So we're going to go through some different movement tests, and we're going to keep asking you about how's your foot, how's your foot, how's your foot.
Okay.
If your back feels sore, that's relevant. But if your back is like, oh, my back feels kind of more sore right now, and you didn't feel any tingling in your foot, that would be a win.
Okay.
Yeah.
Okay.
So the back is relevant. It's just not as relevant as your foot.
Okay.
Yeah. So I think the first movement that we're going to do is knees are straight. I'm going to have you bend forward, reaching towards your toes again. And what I want you to do with this, I'm going to have you lead with your head and then kind of round out your shoulders, just so you're really kind of rounding out your back. Like you're just kind of slumping down all the way down. Once you reach as far as you can go, just come right back up, and you're going to go down again. We're going to do a set of 10 repetitions. If anything felt like it was worsening in the set, you can stop. Otherwise, just do 10.
Okay.
And then
So
we'll
just
recheck.
go with my head first?
You have to slouch and then just go all the way down so we can look at curve reversal here. Yep, just kind of round out your spine, try to slouch it as much as you can. Knees stay straight, just like that. How are you doing so far?
Fine. Yeah.
We'll probably make this one your last one.
Okay.
All right, so tingling in your foot, has that been affected at all by doing this?
Possibly a little bit less. I can still feel it a tiny bit, but I think it's less.
Okay,
Yeah.
a little less. How did your back and hip area do?
Fine. Like they actually feel okay. I'm not feeling any pain right at this moment. Yeah.
Okay. All right. Okay, so now what we're going to do is feet apart, hands on your hips. We're going to do the same exact thing, just opposite motion, where you bend backwards as far as you can go. And if anything's worsening as you go, we don't have to do 10.
Okay.
But otherwise, we'll complete 10 and recheck again your foot and your hip and back. Just like that. As far as you feel that it'll go. Perfect. Good. While you're doing it, any obvious changes so far that you can tell?
No.
Okay.
I mean, I probably feel a little bit more tingling in my foot from doing that.
Okay.
Yeah.
So felt like maybe it reduced some with bending this way. Maybe it's increased some by doing this. Okay. So now we have a decision point. We either look at extension unloaded, we get gravity out of the equation, and recheck. If that was aggravating, we would know that that motion is out. But this is extension in weight bearing. So we could potentially look at extension unloaded. And so I think I'm going to do that just to be thorough about knowing what extension is going to do. So here's what we're going to do next. Let's have you lay down, maybe head up this way,
Okay.
laying on your stomach.
On my stomach. Okay. Oops.
The other reason I'm interested in looking at this motion too here, sleeping on your stomach seems to be the best thing for you.
Right. And what I've been doing like every morning and every night is doing these help a lot.
Oh, okay.
So that's a relief for me. Yeah. Like that. So the things that I've been doing every morning are those.
Okay.
And I've been doing cat cows. Those seem to help.
Yeah. Okay.
And then on my hands and knees, lifting my back leg up. Those seem to help. Being really conscious of keeping my back straight.
Yeah, good technique. What were you going to say?
I was just saying, just breathing into it really helps.
So this is keep going, but this is something that you do in the morning. Do you do it during the day at all?
I do, especially if I'm in pain, I'll do it during the day. I mean, I actually brought a yoga mat into my office.
Okay.
So I could do
and that
this.
Helps.
It helps, yeah, it can. I mean, if it's really bad, this doesn't help.
Okay, got it.
But if I'm having, it's not too bad, then I can usually do this, and it'll get a little bit better.
Okay. Now, if your leg is aggravated, can this help?
Well, when it's aggravated, it's my leg and my back.
Yeah.
It's kind of a package.
So
deal.
doing this helps
both.
Okay. Now, what I'm going to have you do on the last 3 reps of this set, I don't know, I'm not keeping track here, I don't know how many this is, but maybe this is started now.
Yeah.
So let's come all the way up. Keep the elbows locked. Now blow all your air out and think about sagging your stomach to the table without letting this drop at all. Yeah. Okay, now come back down. Okay, let's come back up. Keep that up. Now blow out. And let that sag. Yes, you okay? All right, let's do one more of those. All the way up, lock and sag. Good. Okay, and come back down. And actually, if you want, you can come back up in standing and then let us know about your foot.
I mean, it's almost gone. Like that's almost gone. Like I really don't feel much at all as far as
the tingling.
Yeah.
And then back and hip.
Feels good. It always feels
good.
better when I do that. Yeah.
Okay. All right. So let's recheck. Hands on your hips and bend backwards as far as you can. So now I'm looking for the deviation to see if she's evening out or if that's still there. Okay. Okay, now I'm going to take a seat on the edge of the table there and recheck the reflexes. Let's keep the legs relaxed. Whacking your knees there. So that's still, okay, let's keep an eye on that. Okay, so with respect to that exercise, so there's other things we could test today. We could look at core strength and test how well is your core performing. I think that'll be important to do, and we'll definitely do that. We can check, hip strength. We can check various things, but this is kind of the foundation of your recovery in phase 1. Phase 1 is to make the nerve happy. So the most relevant thing we can do is this concept of what we call directional preference. It's identifying the right movement done the right way with the right amount of repetition to induce that centralization. So I think the key with this exercise, it appears that, like you said, it helps you. It looks like it helps you right now. So the question in my mind is, how many repetitions are needed to maximize what you're going to get from that exercise, and do we need to progress the exercise? There's a couple different ways we can progress that exercise to make it a deeper stretch. So if you are doing that plus the number of repetitions that we'll talk about, and it resolves your leg, or you plateau, that's the next thing we need to move forwards, to know that piece of information.
Okay.
So the number of repetitions, first off, that we want you to do per day is minimum is 60 reps per day. So that could be, it kind of depends on how you're going to fit it in your life.
Right.
You could do 2 sets of 10, 2 sets of 10, 2 sets of 10.
Mm-hmm.
I think in a perfect world, we would have somebody do, 10 or 15, 4 to 6 times per day.
Right, yeah.
Where you keep doing the motion throughout the day to stay ahead of it.
Right.
But not everybody's able to do that with work or school or whatever it is.
Right. Yeah.
So, you'll just do the best that you can, but I want you to think about, okay, at the end of the day, did I get in at least 60 repetitions of this motion?
Okay.
The second thing is, when you're doing a set of 10, the last 3 repetitions, I want you to do the lock and sag. Mm-hmm. Kind of a forceful exhaling. Mm-hmm. It's your birthday and you gotta blow all the candles out. Mm-hmm. And as you're blowing out, you don't let the arms give, mm-hmm. and you're letting your stomach sink into the table. Mm-hmm. Is all that does, just deepen the stretch.
Right. Okay.
Save that for the last few repetitions.
Mm-hmm.
The first several are allowing you to kind of get movement going, get it warmed up, and then the last few you go into those bigger stretches. Mm-hmm. So I want to try those 2 things. Add a little more force, add a little bit more reps per day. Mm-hmm. And then the second thing is going to be, when you are sitting, I want you to sit like we were talking about earlier. Mm-hmm. I want you to maintain a neutral spine mm-hmm. while you're sitting. So one of 3 things is going to happen by doing this. You're either going to get to within the next 24 to 48 hours, mm-hmm. you're going to know what this is going to do. It's not going to take long. Mm-hmm. So in that time frame, if you were to say, it's the same. I don't feel like it's helped me any further, it's not aggravated anything, it's kind of about the same. Mm-hmm. If that's the case, we definitely need to make a change in what we're doing with this motion. Mm-hmm. If you were to notice anything about your foot and leg was increased, mm-hmm. you need to shut the exercise down completely until you come back. Mm-hmm. And then if it's improving, then what we would do is say, great, let's keep that exercise going, let it keep improving, and then we'll probably continue our exam, meaning we'll look at your core function and mm-hmm. things like that and progress that way.
Okay.
So kind of just really depends on what happens the next time you come in, which move we're going to make next.
Okay.
It is a lot like a game of chess.
Yeah.
I'm not allowed to move 3 pieces at once.
Yeah.
I get to move 1 piece because the opponent is your symptoms. Mm-hmm. So I get to make a change, and then we have to wait and see what the opponent does. Mm-hmm. If it makes a move that it's falling into my trap, then I'm going to move a certain way.
Right.
And then if it's like, oh shoot, I don't know if I should have moved that way.
Right.
I'm going to change my strategy.
Yeah.
Either way, though, it looks like a fixable condition in physical therapy. It's just fine-tuning what you need to do, how much of it, how aggressively, which we might have to change the angle of this exercise, mm-hmm. depending upon how you respond. We're going to tweak that. The core strengthening part is simple. Mm-hmm. It's easy to test it. It's easy to prescribe exercises. It's easy to build that up. But
and I've been working on, that's one of the things we've certainly been doing in, a lot of dead bugs, a lot of that kind of stuff, trying to really focus on my inner core. Mm-hmm. So yeah, we definitely have been, working on that in everything that I do.
Yeah.
Yeah.
Good. And that's also another reason that's not my top priority today. Mm-hmm. Is if you were coming in here very sedentary, deconditioned, poor posture, just low activity levels kind of a thing, we'd be more concerned about core strength and function and things like that. But I'm cycling, I'm lifting weights, I'm a personal trainer, I'm doing all these things. Yeah. You're keeping yourself in great shape and strong and things like that. So. Mm-hmm. It's more about understanding how to alleviate the irritation on that nerve, and then fitness, core fitness, and fitness in general is going to be more viewed as, a good preventative tool mm-hmm. in addition to what we're doing. But we'll still look at it too in case there's something we want to add to what you're doing from a fitness core standpoint. We'll still look at it.
Okay.
But this really is going to be the key.
Okay. So, question, like when it comes to hiking, walking, mm-hmm. like I said, that's, how far do I push that? I mean, I'm a pusher, so it's like,
mm-hmm.
I definitely will go to the point where I'm in a lot of pain.
Gotcha.
how far do you push that? Like, do you go to that point? Do you not? Does that help? Does it make it worse? What?
I would say, for purposes of the, when we think about the chessboard analogy, if you said walking aggravates it, and I said totally stop walking and start my exercise, and you came back and said, well, I'm feeling better. Are you better because you stopped this, or are you better because you started that?
Right.
So I would say, for purposes of right now, between today and the next day that you come in, I would say don't change anything about your day-to-day routine.
Okay.
Keep doing exactly what you've been doing. From a workout standpoint, walking standpoint, I want you to kind of keep that similar process going. I mean, yes, we wouldn't tell you to, if you're deliberately going for walks and you're done with a walk, you have full-blown numbness and tingling in your leg. No, we would say you should back off.
Right.
But aside from that, aside from a blatant flare-up of your leg, I would say keep your lifestyle the same so we can know how much of an impact is this exercise having on you.
Okay. Because see, what I was actually asking you is, can I go for a hike?
Have you been hiking now?
No.
Just wait.
No, because I've been afraid to. Because if
Gotcha.
I go too far, getting but.
So for now, just don't add. See, that's back to chess again.
Yeah.
It's like, well, we changed this and this and this.
Yeah.
So, we'll know the answer to that question of when you can start hiking quickly.
Yeah.
But as of right now, don't add that in.
Yeah. Okay.
Yeah.
Okay.
Good question. What else?
I guess that's it. I mean, I guess just keep doing what I'm doing then, as far as my workouts and writing and stuff like that.
Yes.
Okay.
Yeah. That all sounds great. It's just bigger dosage, a little more, just bigger, deeper stretch on those last few, more reps, really be conscientious about your posture, and then we want to see, can we get that tingling to go away or just be significantly less? Can we get it to shift and change by doing that?
So question too, because I've gotten two different opinions from that MRI that I had, as far as, Dr. Ho said, he thought it was calcifying around the disc. Dr. Can't pronounce his last name. Said that he didn't think that was the case. So I'm like, I've got two different opinions.
Yeah.
And part of me goes, do I need to have somebody else look at that?
Gotcha. Yeah. Well, that there was a study that was done not too long ago that took spine surgeons, and they weren't allowed to meet the patient. They just looked at MRIs, and their job was one of the purposes of the study was to see if they could predict people's symptoms by looking at the imaging. So they had all these patients that had described their experience. I have pain in my leg, I just had pain in my back, walking aggravates it, or sitting, whatever the behavior was, whatever their symptoms were, how chronic was it. And the spine surgeon's job was to look at the picture and say, this person's got sciatica, this one doesn't, things like that. And the correlation between those two things was poor. So what that tells us is what your picture looks like is a poor predictor of how you're gonna do and what we're gonna do to help you get better.
Gotcha. Okay.
So it's okay to get some discrepancies in explanations about, this is what's going on and this is what you need to do about it. It's hard to make those predictions.
Okay.
What they're really looking for, MRIs are good for the two S's, safety and surgery. Safety, like, there's a tumor in your back, there's a fracture, something dangerous, something that we wouldn't want to be fiddling around with this.
Right.
And the second one being surgery. If there was something obvious and unmistakable that had to be operated on, they need to know where to go.
Right.
But beyond those two things, MRIs can be misleading.
Okay.
So I wouldn't worry about they said this and they said this. What does that mean?
Right. Okay.
I wouldn't worry too much about that right now.
Okay.
Because that's a very common problem.
Okay.
Yeah.
All right. Okay. Well, I will do these and do more of them. I know that Dr. The chiropractor he was the one who started me on doing this, and he had wanted me to go deep into them, and I know I'm not doing as many as he would like me to do. So.
Yeah, and so once we check that off the list, then like I said, we might have to change the angle of the movement, where we move your hips a certain way and do the exercise. I might need to put my hands on your back while you do it. That's the next step of deepening the stretch. So there's a couple little nuances we've got to check off our list, and then depending on how you're responding to that, is kind of the next path that we take.
Okay.
Either way, though, prognosis looks really good. I think you're going to do great.